Hey, what's going on, everybody? Dr. Brandon Rosie with Rosie Physiotherapy, and I wanted to talk about an article that came out in the Wall Street Journal. And this is something that, as a healthcare provider, and likely if you're watching this, you're either a healthcare provider, a prospective healthcare provider, or you're a patient, then this is going to pertain to you or at least someone you know and love. Social Security costs expected to exceed total income in 2020 as COVID-19 takes financial toll. So here's an article from the Wall Street Journal. I want to talk about it, and let's get down to it. So over here, you could see it says, and like I said, this was posted from the Wall Street Journal just yesterday. So it says Social Security costs expected to exceed total income in 2021 as COVID-19 takes a financial toll. Now, it is of no surprise that, of course, everyone's going to blame everything on COVID-19. However, Medicare's been running out of money. Medicare, Social Security, all of it. They've been running out of money for, decades. And it's been a known, zero-sum game. That there's been, actuaries and the finance guys and girls saying, hey, this isn't going to last. And so over here, so you got to deal with all that. Let's just zoom in a little bit. So Washington, the severe economic downturn caused by the COVID-19 pandemic last year weighed on the financial health of Social Security, but not nearly as much as forecasters originally feared. So yay. And my presumption is that that sentence alone is realistically, although it sounds incredibly horrible, and I'm not here to negate whether you believe COVID-19 is real or not. The fact is, many people died. I don't want to take that away from anyone. And here's the thing. Most of the individuals that died were older, were on the Medicare Social Security system. And the reason I say Medicare and Social Security is because a lot of times they're linked together. A lot of times they're not truly linked together, but typically if you're taking Social Security, you're also taking Medicare and vice versa. However, most of the people that did die from this were on these two systems. And not saying anything different between the two, but that's a line item that is falling out of that budget. So, to say that not nearly as much as forecasters originally feared, well, that's because a lot of people died that are no longer able to take from that system. Trustees for the Social Security Fund in an annual report released Tuesday said its program is expected to pay benefits that exceed its income in 2021, the same as anticipated last year at the outset of the pandemic. So that's nothing new, basically saying nobody's providing because nobody's working. Well, if you stop giving everybody a bunch of free money, then they'll have to go back to work and they'll start contributing back to society. While the pandemic had a significant impact on the program, they expect Social Security's reserves to be depleted by 2034. That's 12, 13 years away. Only 1 year sooner than they estimated in their April 2020 report. So their April 2020 report didn't know about all of COVID because it was just starting. The pandemics, the lockdowns were just starting. They were still in their infancy stage. So once those reserves are exhausted, benefits would reduce automatically unless Congress steps up to shore up the program. And I believe the benefits reduced to around 76%. So taking into the fact that life is costing more and more every year, you're now going to make less despite the fact that you've contributed your entire life. So, and then if you were, let's say, 40 years and younger, I wouldn't even go into this expecting that you're going to have a single dollar of Social Security for you. As such, the reason I started this is that we need to be, as financially independent and as, safeguarding ourselves, because if you're expecting for any company or government to take care of you, you are wrong. And I truly hope I'm wrong on this, but I don't think I'm going to be. In which case, the best hedge you could take for your future is to live as if that Social Security check is never going to exist ever. And in doing so, if you do get, let's say, $200 a month, $1,000 a month, or whatever it is that they decide to give you, whatever's left, well, that's just icing on the cake. That's gravy. But I wouldn't go into your retirement thinking that Social Security is anything. The trustees now projected elevated mortality rates, that's how many people died, related to the pandemic through 2023, and expect lower immigration and childbearing this year and next. That's the thing. At the beginning of all of COVID, everybody thought that there was going to be a massive influx of babies. Instead, we had a massive influx of the divorce rate. The babies, the number of children being born are exponentially low. That's what happens when you force everybody to be together all the time. They don't love their spouses or they're getting in fights. And then, of course, they're starting to nitpick at each other. And of course, the alcohol rate went way up. Well, alcohol doesn't help with baby making. well, at least baby, surviving, failure to thrive. They also expect the pandemic has lowered worker productivity and thus economic output permanently. I wouldn't say worker productivity has been lowered, maybe just the number of workers in the workforce, because again, when you print money and you give people so much money to stay home all the time and not work, well then you're not going to have people contributing to society. So I wouldn't say it's the productivity of the workers, because Google and Amazon and many other massive corporations have shown that not only has productivity increased substantially for the number of workers, that it's allowed more line items in the budget to be used for R&D, research and development. Senior administrative officials said they expect higher inflation this year. No duh. Will significantly boost benefits next year. Well, that's just because they're taking more out of your check. Estimating Social Security beneficiaries could see close to a 6% cost of living increase. Okay, great. That would be the highest annual benefit increase since 2008, when rising gas prices pushed the cost of living up to 5.8. At this rate, our cost of living is going up way more than 6%. By comparison, beneficiaries saw 1.3% cost of living adjustment in 21 and 1.6 in 2020, respectively. Tuesday's report was the first formal update from the Social Security trustees incorporating their best estimates of the effects of the pandemic, which triggered widespread business closures, layoffs last year, and state and local officials imposed restrictions to curb the spread of new cases. Unfortunately, many of those businesses are closed. They will never come back. And many of the individuals that did take a risk on opening up a business are so severely scarred that they're never going to open a business up again. And so many of those jobs are not coming back. On top of that, I've been talking with some other thought leaders in the subject, and basically there's a lot of jobs that are just never going to come back. How many businesses saw that after the, not the financial crash, but after the COVID crash, they saw that they could work from home, or a lot of their employees could work from home. I know, for instance, my cousin, he works at an IT firm which employs thousands of individuals. They own massive buildings, not a couple floors, not a couple buildings, like 20 stories high buildings. And they at that point decided everybody work from home permanently. They sold the building. That is now a line item that is no longer in the budget. They don't have to worry about electricity. They don't have to worry about insurance to prevent people from slipping on ice or rain or any of that stuff. So they got to make money. They got to make a profit margin off selling that building. And there's a huge line item being rent. Your actual building, brick and mortar, is no longer the item. So a lot of people got bonuses. They got to put more money into infrastructure to allow them to, build stronger and better, more secure servers, because people were working from home, their private connection. But other than that, there's a lot of jobs that aren't coming back. The resulting deep recession significantly reduced payroll tax revenue. Again, stop paying people to live at home, and once they go back to work, then more people are going to be on payroll. There will be more payroll-based revenue, hence the Social Security tax as well as the Medicare tax that comes out of your paycheck. And again, if you are self-employed, you're going to be paying that twice. That loss of income was partially offset by the fact that the virus pushed up mortality rates, especially among older Americans who were more likely to be beneficiaries, thus reducing near-term program costs. Over the long term, it isn't clear how the pandemic will affect the program. It is possible that if the virus leads to the deaths of the most vulnerable and sickest Americans, the potential beneficiaries who are left may be healthier overall and live longer. Boom, boosting costs. That line right there, this line right there is what I kind of mentioned at the beginning. The fact is the people that died, and I'm not saying all of the people, but a lot of the individuals that died were very, very elderly. They were old. They were sick. They were costing Medicare and Social Security money. And the fact is as they're gone, those line items are out of the budget. I'm not saying that is not a horrendous thing, but the idea is that those who are left, those who were able to fight the disease and survive it, may have a healthier, stronger immune system, in which case they probably won't be in the hospital as often. On the other hand, those who survived COVID-19 may suffer long-term health effects that lead to earlier death and disability. That's very true as well. That's just something we won't know until we have long-term data. And before anybody thinks what long-term data is, you're looking at 10 plus years. And in the medical world, long-term data is not a couple months. It's going to be several years, several decades. Think back to, 40, 50, 60 years ago, we had polio syndrome. And then 40, 50, 60 years later, we had something called post-polio syndrome. People who had polio got better, and then they actually got more symptoms 60 years later. So we don't know. Maybe 20, 30, 40, 50 years from now, we have post-COVID-19 syndrome. We don't know. We won't know until it's time to deal with that. There's an incredible amount of uncertainty. That is, of course, completely true. That happens every single day. We haven't lived through a pandemic like this in over 100 years. Again, also true. Social Security consists of 2 programs. If you don't know this, it's one for retirees and one for people who claim disability. Again, same thing. I know it's not the same as Medicare, but typically if you qualify for Social Security, you typically also qualify for Medicare Part A, and then so maybe even Part B. The trustees estimated the retirement program will be able to pay full benefits on a timely basis until 2033. Previously thought it was 2034. 1 year earlier than before, so we lost a year. After that, the program would have enough to pay around 76% of the scheduled benefits unless Congress steps in and shore up the program. We'll see what they do about that. Probably something that'll be an issue that comes into play with the next presidential election, something to kind of weigh in on there. The estimated disability fund would run out in 2057, 8 years later than projected in last year's report. So again, that means that those who are dying are ones who are taking from that system. I'm not saying it's good or bad. I'm just trying to point out paint a picture here. And they noted that disability applications continued to decline last year, probably because unfortunately with COVID, a lot of people died, and those who were most vulnerable were the ones who succumbed to this illness. So there's less people that are surviving this. And again, it truly is sad. Whether your viewpoints on this are political, apolitical on this, people dying is always a sad thing. Taken together, the program would be able to pay around 78%. So there you go, a 22% haircut on the scheduled benefits after the trust funds are depleted in 2034. The report also said, there we go, Medicare's hospital insurance fund would be depleted in 2026. For those of you who don't know, that's when you go to the hospital and you're over the age of 65 or you have a disability, then you are covered for your Part A benefits. That's your hospital insurance covered. And so that money is going to be depleted in 2026. That's why I always said you need to have a backup plan. You need to be financially, secure and not relying on the government to take care of you, because unfortunately this continues to decline. And as a healthcare professional, in the last 6 years, all we've seen is 2%, 4%, 6%, 8%, 9% pay cuts with Medicare year over year, which means less and less doctors are going to be willing to accept Medicare as a form of payment, in which case those beneficiaries, the individuals that are on Medicare, are going to have less and less good doctors who are going to be available to treat them. And this year alone, we are all taking a 16% pay cut. 16% pay cut, whereas at the exact same time, cost of living is growing astronomically. The cost of labor, the cost of material, the cost of living has gone up astronomically, whereas our cost of providing service has gone up, but what we're being paid by the government has gone down substantially, almost a 20% hit. And in the last 3 years combined, around a 24% overall. That's a quarter of our payment. And that is why many doctors, myself included, are basically at the point where we're saying we can't treat Medicare beneficiaries anymore. And that is a true shame to all of our working citizens and those who provided into a system their entire life, and now are not going to be able to receive those benefits or get treated by the doctors that they always expected would be there for them. So either way, I wanted to give an update on what this was going to look like. I wanted to let everybody know that here's my thoughts. This just came out. I think it's something that isn't going to be talked about enough. A lot of people are just going to kind of brush over it and just kind of shrug their shoulders and say, oh, well, COVID happened. This is another thing that happened. But realistically, this is something that's been going on for decades, something that, they can blame COVID to be a major change of this. But really, the worst thing it said was after COVID, benefits are going to run out 1 year sooner than what was expected. But for those taken into the disability program, they gained 8 more years. Again, still not much has changed. The standard deviation on that is very, very small. So either way, those are my thoughts. If you have any questions, reach out in the comment section. Thank you so much for watching, and I'll see you later.